Hi there, I'm Oran Kivity and I'm going to talk to you about what happens in Manaka Made Simple Level 3. Well, as you might expect, we're going to learn some more IPC patterns, some more ion pumping cord patterns. And these patterns, as usual, will be diagnosed from the belly. So we'll learn something called a Yang Ming pattern, a 4 gates pattern, and a triple burner pattern. And these have various uses and they come up sometimes when you're palpating. But more interestingly, this time, we're going to learn a symptomatic way of applying ion pumping cords. In other words, are there ion pumping cord treatments for specific conditions? And we're going to learn how to treat anxiety and depression, poor energy, knee pain, sinus problems, tooth pain. So we're going to learn how to use ion pumping cords in a different way, which is not dependent on the belly. Now, as ever, it won't just be theory. We're going to be learning some more clinical approaches, and these clinical approaches are really going to deepen our understanding of Dr. Manaka's ideas about blood and blood stasis. So on level 1, we learned Kyutoshin, and Kyutoshin we've seen as a way of gently moving qi and blood and increasing the circulation. Manaka talked about it as softening and relaxing the muscles, which is a way, in other words, of moving blood in a mild way. And we also looked at rice grain moxibustion. So Fukaya's idea about a moxibustion point was it has to have induration, it has to be reactive. So when we do moxa, we're working not on the chi level, but on the blood level, on this deeper level. And we use moxa for chronic conditions. So moxa works on the blood. Now we're going to be looking at Manaka's ideas about blood stasis and his model for diagnosing blood stasis and for prognosis. So Manaka would talk about 3 stages of blood stasis and the different signs on the body, on pigmentation on the body that would indicate which stage someone was at, and then how we could use that information to prognosticate. So we can say that if someone has a 3rd degree blood stasis, then we know that their condition is not going to get better in a hurry, and our treatment is going to be largely palliative. Whereas if they have 0 or primary stage blood stasis, then we can guess that they're going to do very well and they're going to respond very well to acupuncture. So blood stasis and Manaka's ideas can be used for prognostication. But more than that, we're going to look at clinical ways to affect the blood. So 2 new techniques, cupping and bloodletting. So dry cupping just with cups and wet cupping using bloodletting. And not just bloodletting over cups, but also bloodletting at the Jingwell points, bloodletting at vascular spiders, and bloodletting at thick areas of abnormal tissue. So where we find abnormal tissue, we can also do bloodletting. And there are various ways of doing bloodletting. So just pricking one point or tapping with a needle. So really interesting ways. And I'm going to be talking about Dr. Manaka's approach to bloodletting, and I'm also going to be sharing some of my own personal experience of bloodletting, which also involves some knowledge from Master Tung. I've got one more thing to say about this course, which is its duration, because normally I used to teach this as a 2-day course, but we are going to be running it over 3 days. And the reason for that is we want you to practice everything, and we want you to come away from level 3 with a real sense that you've come to grips with all the stuff that we did in level 1 and level 2 and the new material that we're going to do in level 3. So we're going to have an extra day just devoted to revision and review and practice. Well, I think that that really covers what we're going to be doing in level 3. We're going to be focusing on Dr. Manaka's ideas about prognostication, including blood stasis. We're going to be looking at really working on the blood directly through bloodletting and through cupping. And then, of course, we're going to practice, review, and practice. I look forward to seeing you then.